Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on a series on micronutrients. I refer to a fantastic review article, hot off the press, in the New England Journal of Medicine, published March 5th, 2025. This podcast is on vitamin D deficiency, which is common in the US. Those with levels less than 25 nanomoles per liter, according to the enhanced data, is around 2.6%. 25 to 50 nanomoles per liter is around 22% of the population. And 50 to 75 nanomoles per liter is 40.9%. Higher prevalence in women and non-Hispanic Black Americans. Winter months, there's a higher prevalence because of low UVB exposure. In young adults, 20 to 29 years of age, there's a higher prevalence. And those who live in low sunlight and on poor diets. Breastfed infants also have a higher prevalence. Vitamin D metabolism. UVB light converts 7-dehydrocholesterol to pre-vitamin D3, and pre-vitamin D3 in turn is converted to cholecalciferol or D3. Liver converts vitamin D3 to 25-hydroxyvitamin D and is the major circulating form. And the kidney converts 25-hydroxy vitamin D to 125 dihydroxyvitamin D, which is the active form. Source of vitamin D: fatty fish, salmon, mackerel, sardines, eggs, beef, liver, mushrooms, especially vitamin D2 form, fortified foods, dairy, breakfast cereals, and fortified grains. Sunlight exposure. This is indeed affected by latitude, season, skin pigmentation, and sunscreen use. This affects me. I live in Ohio, where with many gray days. Recommended serum levels and intake. When the vitamin D levels are less than 30 nanomoles per liter, it's considered vitamin D deficiency. Adequacy, when it's above 50 nanomoles per liter. According to the American Endocrine Society, what's optimal for bone and muscle health is greater than 75 nanomoles per liter. The recommended daily intake from the age of 1 to 70 years is 600 international units per day. Those above the age of 70 years, around 800 international units per day. Clinical studies on vitamin D, large-scale trials, the VITAL study, 25,000 participants, which is over 5 years. There was no effect on cancer, heart disease, depression, no improvement in bone density or fracture prevention. However, a recent meta-analysis showed that mortality associated with cancer was reduced by 25%, excluding the first 2 years. We need more research, and the ongoing research is in diabetes, autoimmune diseases, cognitive function, and longevity. Safe intake, up to 4,000 international units a day. What are the risks of excess? Kidney stones, weakness, GI issues, and hypercalcemia. D3 versus D2. D3 is cholecalciferol, more potent and longer lasting. D2, ergocalciferol, less effective but still useful. Vitamin D in special populations. In infants and children, breast milk is low in vitamin D. The American Association of Pediatricians recommends 400 international units per day for infants. However, the adherence rate to this advice is only 27%. Pregnancy and lactation, there's an increased need for vitamin D for fetal development. In the elderly, there's reduced skin synthesis and dietary intake, high fracture risk, and indeed the need for supplementation for vitamin D. Key takeaways: vitamin D is essential for bone health, immunity, and muscle function, possibly mental health, especially when people are on the beach in the sunlight, they feel much better. Deficiency is common, especially in at risk populations. Sunlight, diet, and supplements play key roles in maintaining levels. Clinical studies have shown mixed results, but ongoing research continues. So-called safe supplementation is up to 4,000 international units per day with monitoring for toxicity. This is in a nutshell about vitamin D.